Hello and welcome to another edition of Spotlighting Jonesboro. Today with me I have Alicia Storey, who is the Oncology Programs Manager at St. Bernard's. She's here to talk to us a little bit about cancer. So Alicia, I want to thank you so much for being here.
Well, thanks for having me.
Tell us about some of the statistics about cancer in our region.
So some statistics for the state of Arkansas. Almost 15,000 people are diagnosed every year in the state of Arkansas. It's the second leading cause of death here in our state. So obviously it's something that impacts a lot of people, whether it's directly or indirectly through their family. An important issue and very important to our community for sure.
Well, does our region differ from others in the nation in regards to cancer?
It does somewhat. So when you look at the most common types of cancer, for Arkansas, number one is lung cancer, then it's followed by breast, colorectal cancer, and prostate. That's what it looks like in Arkansas, but when you look at the nation, lung cancer actually has moved to third. And the reason that is because we have so many smokers in our area, which is sad because lung cancer is actually the deadliest of all those cancers. It's responsible actually for more deaths than breast and prostate and colorectal combined. So if there's something you're looking to do to help decrease your risk of getting cancer, it's quitting smoking would be a good place to start.
What are some of the trends in cancer right now?
Some of the new things that have kind of been on the scene that are really changing the way we're looking at things, one thing would be genetics. So you may have heard through Angelina Jolie, she had a genetic mutation. We're learning now that a person's genetic makeup actually may put them at higher risk for developing some types of cancers. So we're able now to test some of those folks that are high risk and see if maybe they're going to develop those cancers earlier or more frequently than someone else could. Really changes their outcomes because if we know that you're high risk, we can change the way that we look at it and we start looking at it more frequently. It also, genetically, we've been looking at ways that they can target the cancer treatments. So looking at your specific makeup and the genetic makeup of your tumor and how it acts, they can actually target your treatment. So that's a big thing that's come about in the last few years and something we expect to see as research continues in that area. Also, another big thing on the scene, we were talking about the statistics earlier, how we have lung cancer more prevalent in our area than in others. And we talked about the difference in the death, so breast and prostate and colon are not really deadly cancers. And the reason that is because when you find cancer early, it's a whole lot easier to treat. And if you think about it, we have screenings in place. So for breast, we can do a mammogram. For colon, we can do a colonoscopy. For prostate, we can check a patient's PSA. But in the past, there's never really been anything for lung. So we know that is a big reason that lung is so deadly. So one of the big things, probably the biggest thing to happen in cancer in the last 20 years is that they have actually come out with some new research that shows that there is a good screening tool for lung cancer, and that's a CAT scan. It's a specific type of CAT scan, and it's only for a specific group of people. So if you're high risk, so high risk would be anybody that's 55 to 74 who has a 30-pack year history of smoking. And so if you want to calculate and try to figure out what your pack year of history is, if you smoke 1 pack a day for 1 year, 1 pack a day for 30 years, that's a 30-pack year history. If you smoke half a pack a day for 60 years, that's a 30-pack year history. So those are the folks that would be at high risk. And those are the folks that would need to have that screening done every year. So that's a big thing, and we hope that it has the same impact on lung cancer that mammography has had for breast and those other screening programs. We are actually expecting Medicare to make an announcement any day now that they're going to start paying for that test. So that's big news, something that people need to be talking to their physician about for sure. Really exciting.
That is great. So with all these treatment options, let's talk about life after cancer.
Because we have such better targeted therapy and because we're diagnosing cancer earlier and we're treating it, we have this huge population of people out there in our community that are cancer survivors, and it's a growing population, and it's a wonderful thing. But it's really important, this is a unique group, and they have unique needs. Some of it's emotional, the fear of the cancer coming back, the transition of their life to going back and maybe away from their oncologist into the primary care, or not looking at getting tests as regularly to make sure it's not coming back. And then sometimes they have long-term emotional and even physical side effects from their treatment. So this is definitely a unique group. Survivorship has become another big change and a big trend. We want to be sure that we don't ignore that population. So I know at our center we're developing what we call survivorship care plans. And it's something so when the patient finishes their treatment, we give them something, it's got a treatment summary. so that when they transition back to their primary care physician, that physician knows exactly what they have had in the past, and it's also got kind of a summary of what they need to get. So what testing they need to do, if they need to have a mammogram every 6 months or they need certain blood tests, that way the primary care physician and the oncology team's on the same page. And it also addresses some other long-term side effects that they may experience, gives them some resources, and just helps them transition into that part of life.
How important is a patient's choice when choosing where they get these treatments at?
I would say that probably that's one of the most important decisions that a family or patient has to decide once they find out they have cancer. It is critical that you have a good relationship with your physician, that you have confidence in them and that you trust, and not just with your doctor, but also with the center and the folks that are going to give you your treatment. So I think it is really important that they choose the right place, and just some criteria and some things to look for. Number one would be location. You know, it's a long road sometimes going through the treatment. So it's really important that you have your support team with you, both for emotional support and just the logistical things of trying to get back and forth to appointments, and then try to cover your normal life, getting the kids and the grandkids where they need to go, that kind of thing. So you have to decide, is this something I want to stay local, or can I afford to go off somewhere for treatment? So location is a big thing. Another thing to consider is, does this program that you're looking at, do they have all the pieces? So we've talked about a lot of things. Do they have genetic counseling? Do they have someone at their facility that's going to be over clinical trials, that will be looking at my case to see if I qualify for any of those clinical trials? Do they have a cancer navigator that's going to be there for the social and emotional support, help me navigate this journey? Do they have a survivorship program to transition into survivorship? Do they have a multidisciplinary team? So that's another big thing. I know at our center, not only does your physician review your case, but we meet weekly, and your case is presented not just to your physician, but an entire team of physicians. So you've got 7 to 10 doctors that sit around a table and look at your imaging and look at your pathology and come up with a treatment plan that they all agree on is best for you. So you want to make sure that you have all those pieces in place. And then ultimately, quality. I mean, you're looking for a place that's going to give you the right kind of treatment. You know, there are lots of national guidelines and best practices and treatments that are proven to work. And you want to make sure that you're at one of those facilities that's providing that kind of care. So one way that you can do that is there's a national accreditation program. It got started by the American College of Surgeons. It's the Commission on Cancer. We call it the COC for short because it's a lot of words. But they actually look at cancer programs and they measure them really detailed on all these different aspects. They look, do they have all those pieces in place that we talked about? They look at 34 different quality standards to make sure that they're actually treating each of those different types of cancers appropriately. And not only do they come in and survey them one time, it's actually an ongoing quality review. So all their patients' information is actually uploaded to a national database, and this Commission on Cancer is a team of physicians, and they're looking at that and they're reviewing it, making sure that you're providing the best quality care. And if you're not, they're in constant contact with you and let you know, hey, this is an area that needs to be fixed, we need to look at this, we need to review it, you need to put an action plan in place. So, you know, that's great reassurance to know that it's not just that institution looking at the quality, it's a national program. So you can look on that institution's website to see if they have that logo on there, call them, talk to your physician about them, ask them if the place that you're going to go is somewhere that is accredited by the Commission on Cancer.
I want to thank you so much, and hopefully we can have you back.
Thanks for having me.
When some new information comes up. So thank you for watching Channel 24.